As men move beyond their 60s, there's often an unspoken shift that occurs deep within both the body and mind, one that many don't discuss out loud, not with their doctors, not with their partners, and sometimes not even with themselves. And this shift is rooted in the subtle, gradual decrease of one of the most primal forces that has driven much of their life up to that point: the regular release of sexual energy. And while the physical act of release, whether through intimacy with a partner or solitary self-pleasure, might seem trivial or even optional as one ages, the absence of it over extended periods can begin to create a ripple effect through the body's physical, emotional, hormonal, and even psychological systems in ways most men aren't fully aware of. Because what happens when that release is withheld for too long is not just a question of libido or frustration. It's a question of male vitality, prostate health, emotional balance, sleep quality, cardiovascular regulation, hormonal feedback loops, and the brain's reward and stress systems. And when men over 60 choose, either by circumstance or belief, to abstain from releasing that built-up pressure regularly, the consequences can start slowly, sometimes imperceptibly, and then one day manifest in ways they never connected back to their own biology, because sexual energy is not simply about desire or reproduction. It is intricately tied to the body's endocrine system, which governs testosterone production, dopamine balance, stress hormone regulation like cortisol, and even neurotransmitter activity that influences how a man feels about himself, how confident he is, how clearly he thinks, and how peacefully he sleeps at night. And without regular ejaculation, whether through sex or masturbation, older men often begin to notice a strange combination of symptoms: low energy that no amount of sleep can fix, irritability that comes and goes without warning, restless nights with shallow sleep, a persistent feeling of internal pressure or frustration, difficulty focusing, and even pelvic tension or occasional discomfort around the prostate area that seems to come out of nowhere. And all of this begins because the body, particularly after 60, doesn't stop producing seminal fluid or testosterone. It just accumulates, creating congestion within the reproductive system. And while some spiritual traditions may celebrate retention of this energy as a path toward clarity and vitality, the reality for most aging men is that without intentional transmutation or release, that stagnant buildup can actually become an internal stressor, contributing to anxiety, mood swings, and even chronic low-grade inflammation in the body. And the prostate, a small gland the size of a walnut, plays a central role in this discussion because one of its essential jobs is to support the production of seminal fluid. And when release doesn't happen regularly, the fluid begins to thicken and the prostate can become congested, leading to a feeling of fullness, pressure, or in some cases, mild inflammation that over time can affect urination, sexual function, and overall comfort in the pelvic region. And while not every man will experience severe issues from abstinence, it's important to understand that our biology was designed for rhythm, for flow, for cycles of buildup and release. And when that rhythm is interrupted for too long, it can throw off the entire internal balance of a man's body and mind. And unfortunately, many men who begin to experience these symptoms in silence assume that they're simply part of getting older. But often what's happening is a hormonal and neurological stagnation. And over time, it becomes easier to lose touch with not just the desire for release, but the entire emotional experience that accompanies it. The closeness, the relaxation, the emotional catharsis, the physical decompression that often follows a fulfilling orgasm. And without that, the stress that naturally builds up from daily life doesn't have its usual outlet, leading to mounting tension in the nervous system, an increase in stress hormones, and a decline in feel-good neurotransmitters like serotonin and oxytocin. And this affects everything. Relationships start to feel more distant. The sense of confidence in one's body begins to erode, and even the desire to move, to exercise, or to socialize can diminish, because when the body isn't releasing, it begins to conserve, and not always in healthy ways. It conserves energy emotionally, physically, sexually, and even mentally, and so the man who once felt grounded and engaged in life now feels detached, disconnected, or indifferent, not because of aging alone, but because his system isn't being allowed to complete its natural cycles. And in part 2, we'll explore exactly what kinds of physical and emotional symptoms begin to appear in more detail. How lack of release impacts prostate and cardiovascular health. What science says about the optimal frequency of ejaculation for older men. And most importantly, how regular, mindful release, even if solitary, can radically improve mood, sleep, energy, and the sense of inner peace that so many men over 60 are quietly longing for but don't know how to reclaim. As we delve deeper into the effects of not releasing sexual tension over extended periods, especially for men over 60, it's crucial to understand how intimately connected this natural function is with a host of physical and emotional health factors that often go unnoticed until they become disruptive. And while many men might shrug off these changes as inevitable signs of aging, the reality is far more nuanced and calls for awareness rather than resignation, because the human body thrives on cycles of buildup and release, activity and rest, tension and relaxation, and sexual release is no exception. It is one of the primary ways the body maintains balance within its hormonal, neurological, and cardiovascular systems. And when that cycle is interrupted, the consequences ripple outward in ways that impact not only sexual function, but overall well-being, and scientifically speaking. The prostate gland, which plays a key role in producing seminal fluid, is particularly sensitive to this imbalance, because when ejaculation does not occur regularly, seminal fluid begins to stagnate, thickening and potentially causing mild inflammation or discomfort, which can lead to symptoms like frequent urination, a feeling of pressure in the pelvic area, or even mild pain that can mimic or contribute to prostatitis and beyond physical discomfort. This stagnation can lead to increased oxidative stress and inflammation at a cellular level, both of which are associated with a range of age-related health challenges. And this is important because inflammation is a silent enemy that underlies many chronic diseases, including heart disease, diabetes, and cognitive decline. And so the simple act of releasing sexual energy regularly becomes not just a matter of pleasure, but a vital component of healthy aging. And it's no surprise, then, that men who abstain from ejaculation for too long often report increased feelings of anxiety, irritability, and restlessness, because sexual release triggers the release of endorphins, oxytocin, dopamine, and serotonin, neurochemicals that regulate mood, reduce stress, and enhance feelings of connection and well-being. And without this natural neurochemical boost, the brain can fall into patterns of low mood, poor sleep, and diminished motivation, creating a cycle that's hard to break without conscious intervention. And studies have shown that regular ejaculation, even through masturbation, is linked with a lower risk of prostate cancer, better bladder function, and improved mental health outcomes, highlighting that sexual health and general health are deeply intertwined. And for men over 60, this connection becomes even more critical because testosterone levels naturally decline with age, and without the stimulation and feedback of regular release, testosterone production can slow even further, impacting muscle mass, energy levels, bone density, and even cognitive sharpness. And this creates a cascade effect that touches every aspect of life, from physical strength and endurance to emotional resilience and social engagement. and beyond hormones and prostate health. Cardiovascular health is also closely linked to sexual activity and release, because the mechanisms that govern erections rely on healthy blood flow, endothelial function, and nerve sensitivity, and when sexual activity is absent for long stretches. Some men experience increased arterial stiffness and reduced nitric oxide availability, which can exacerbate erectile dysfunction and reduce overall cardiovascular efficiency. And this is particularly concerning because heart disease remains the leading cause of death for men over 60 worldwide. So maintaining sexual health through release isn't just about intimacy. It's a vital part of maintaining heart health as well. And emotionally, the lack of release often leads to what many men describe as a pressure cooker, feeling a sense of pent-up tension that can increase stress hormones, like cortisol, elevate blood pressure, and create a background noise of anxiety or restlessness that interferes with concentration, relationships, and even sleep quality. And speaking of sleep, regular ejaculation promotes the production of prolactin and oxytocin, hormones that encourage relaxation and deeper, more restorative sleep. And without this natural mechanism, many men find themselves tossing and turning, waking up unrefreshed, and struggling with insomnia or fragmented sleep cycles, which further amplifies the fatigue and mood disturbances caused by hormonal imbalance and stress. And the good news is that these effects are reversible. Introducing regular, mindful release, whether through partnered sex or masturbation, can help restore hormonal balance, improve prostate health, reduce stress, enhance mood, and promote better sleep patterns. And this isn't about frequency for frequency's sake, but about listening to your body's natural signals and honoring your needs with compassion and awareness. And while some men may worry about overdoing it, science shows that there's no magical number that applies to everyone. The key is consistency and attunement to what feels right for you, which might be once or twice a week, or perhaps more or less depending on your health, lifestyle, and personal preferences. And it's also important to recognize that releasing sexual tension isn't just physical. It's deeply emotional and psychological, allowing men to reconnect with feelings of pleasure, intimacy, and self-acceptance that often get lost in the busy routines and stresses of later life. And by reclaiming this natural cycle of build-up and release, men over 60 often report renewed confidence, improved self-esteem, deeper emotional connections with partners, and an overall sense of vitality that spills over into every area of life. And in the next part of this video, we'll explore practical, safe ways to incorporate regular release into your life, discuss common barriers men face, including health concerns and cultural stigmas, and share simple, effective tips to reignite your sexual health and well-being with dignity, ease, and joy, because every man deserves to feel whole, vibrant, and alive at every stage of life. Building on the understanding of how critical regular release is for men over 60, it's essential to acknowledge the emotional and psychological dimensions that accompany this physiological process, because the mind and body are deeply intertwined, and when sexual energy is left unreleased, it doesn't simply vanish. It gets stored, suppressed, and often transformed into tension, frustration, or even self-doubt. And many men find themselves caught in a cycle where the absence of release leads to increased anxiety or irritability, which in turn reduces desire or motivation to seek intimacy or pleasure, creating a downward spiral that affects not just sexual health, but overall quality of life. And this dynamic is compounded by societal expectations and cultural narratives that often discourage older men from expressing or exploring their sexuality openly, fostering shame or embarrassment around natural desires and needs. And while it's true that testosterone declines with age and libido shifts, this doesn't mean sexual expression or release becomes irrelevant or impossible. In fact, quite the opposite. Maintaining a healthy sexual life, including regular release, is foundational to sustaining vitality, mood stability, and meaningful relationships in later years. And to facilitate this, it's important to address some common barriers men face, such as erectile dysfunction, chronic illness, medication side effects, or emotional wounds from past experiences, because these challenges can make release feel difficult or even impossible. But with compassionate care, medical support, and realistic expectations, many men rediscover pathways to pleasure and release that work for their unique bodies and situations. And it's worth noting that release isn't limited to penetrative sex. Masturbation, intimacy without intercourse, sensual touch, and emotional connection all contribute to the healthy discharge of sexual tension and the associated physical and psychological benefits. And exploring these avenues can be empowering, freeing, and deeply satisfying, especially when done mindfully and without judgment, allowing men to reconnect with their bodies, desires, and pleasure in ways that might have been lost or neglected over the years. And another important consideration is the role of communication, whether with a partner, healthcare provider, or trusted friend. As openness about sexual health and release needs can break down isolation and stigma, paving the way for support, solutions, and renewed intimacy. And for men who may be single or without regular partners, cultivating a positive relationship with masturbation and self-pleasure is particularly vital, as it provides not only physical release, but also emotional comfort and stress relief, helping to maintain the hormonal balance and mental well-being essential for healthy aging. And as we move forward, it's helpful to recognize that the frequency and methods of release vary widely among individuals, so tuning into your own body's rhythms and signals is key, honoring what feels nourishing rather than forced, and knowing that this process is as much about self-care and respect as it is about physical health. And finally, as you reintegrate regular release into your life, you may find that your confidence grows, your sleep deepens, your mood stabilizes, and your relationships, whether romantic, familial, or social, benefit from the improved energy, presence, and emotional openness that accompany this shift. And this transformation isn't merely about prolonging sexual function, but about reclaiming a vital part of your whole self, your masculine vitality, your capacity for pleasure, and your ability to connect deeply with others and with yourself. In the final part of this video, we'll explore practical, step-by-step strategies for safely and effectively incorporating release into your daily life, including tips for overcoming common hurdles, advice on communication, and guidance on enhancing intimacy at any age, so you can confidently move forward with renewed vigor, joy, and balance. Because your health and happiness deserve nothing less than your full attention and care. As we come to the final and most important part of this conversation, it's time to focus on actionable strategies and compassionate guidance for men over 60 who want to restore balance and vitality by incorporating regular release into their lives in ways that feel authentic, safe, and deeply satisfying. Because understanding the science and the emotional implications is just the beginning. The real transformation happens when knowledge is translated into practice. And so let's begin by acknowledging that the journey back to a healthy release cycle is unique for every man, shaped by your health history, current physical condition, emotional state, relationship dynamics, and personal preferences. And this means that patience and self-compassion are your most powerful allies, allowing you to approach this process without pressure or shame. And first and foremost, start by listening to your body's natural rhythms. Notice when tension builds, when desire arises, and when you feel ready to release, whether that's through masturbation, intimate connection with a partner, or other forms of sensual expression. And don't underestimate the power of mindfulness in this process. Being fully present with your sensations and feelings during release enhances pleasure, promotes relaxation, and reinforces the neurochemical benefits that regulate mood, sleep, and stress. And if you're experiencing challenges like erectile dysfunction or pain, consult your healthcare provider too. Explore safe and effective treatments, because addressing physical obstacles not only improves sexual function, but also opens the door to emotional healing and renewed confidence. And for those navigating chronic illnesses or medication side effects, know that adaptive strategies exist, such as exploring non-penetrative intimacy, using lubricants or aids, and engaging in pelvic floor exercises that strengthen muscles and improve circulation, all of which can increase comfort and pleasure while reducing anxiety around sexual activity and communication remains key. So share your feelings, concerns, and needs with your partner openly and honestly, fostering an atmosphere of trust and mutual support that makes intimacy richer and more fulfilling for both of you. And if you're single or prefer solo release, set aside time without distractions where you can relax, breathe deeply, and reconnect with your body gently, honoring your boundaries and desires without judgment. And this sacred self-care ritual can become a cornerstone of your health routine, contributing to emotional resilience and a deeper sense of self-appreciation. And to complement these practices, consider lifestyle choices that support sexual health and vitality, including regular exercise to boost circulation and hormone production, balanced nutrition rich in antioxidants and healthy fats, adequate hydration, stress management techniques like meditation or deep breathing, and sufficient restorative sleep, all of which create the foundation upon which a vibrant sexual life can thrive. And remember, age is not a barrier, but an invitation to redefine what pleasure, connection, and release mean to you, to explore new forms of intimacy that honor your evolving body and spirit, and to embrace the fullness of your masculine energy with grace and joy, because the ability to experience desire, release, and satisfaction is a fundamental part of being human at any age. And by choosing to nurture this aspect of yourself, you're not just improving your sexual health, you're enhancing your overall quality of life, mood, relationships, and even longevity. And so as you take these insights and tools forward, know that you are supported by a community of men and health professionals who understand the unique challenges and gifts of this stage of life, and who celebrate your courage to prioritize your well-being, pleasure, and connection. And finally, allow yourself to envision a future where regular release is no longer a source of stress or confusion, but a source of strength, peace, and vitality that fuels your days with energy and your nights with restful sleep. And where you can look in a mirror with pride, knowing that you have chosen to honor your body's natural rhythms and reclaim your masculine power in a way that feels whole, authentic, and deeply satisfying. Because this is not just about sex. It's about life, joy, and the radiant expression of who you are at your core. And as you move forward on this path, may you find renewed confidence, deeper connection, and a lasting sense of peace that comes from listening to your body, loving yourself fiercely, and embracing the beautiful, powerful man you are today, tomorrow, and every day beyond, because you deserve nothing less.